If your legs have been feeling heavy, tired, or painful lately, and you have been brushing it off as just getting older, please stop and listen carefully. Doctors are now warning that certain leg symptoms after the age of 65 are not just signs of aging. They could be your body's way of telling you that something dangerous is happening inside your blood vessels right now. What I am about to share with you today could be the difference between catching a serious problem early and missing it entirely until it becomes a medical emergency. So please stay with me through this entire video, because every single section contains critical information that could protect your health and even save your life. Let me describe something that happens to millions of seniors every day and see if it sounds familiar. You are walking through the grocery store, or maybe you are just taking a short stroll around the neighborhood, and suddenly your legs start to ache. The pain might be in your calves, your thighs, or even your buttocks. It feels like a cramping or a squeezing sensation, and the only thing that makes it better is stopping and standing still for a few minutes. Once you rest, the pain goes away, so you think nothing of it. Maybe you tell yourself that you were just out of shape or that your legs are tired because you did not sleep well. But what if I told you that this exact pattern of pain that comes with walking and goes away with rest, is one of the most classic warning signs of a condition called peripheral artery disease, and it affects millions of seniors who have no idea they have it. I am Dr. Charles Anderson, and today I am going to walk you through the leg signs and symptoms that every senior over 65 absolutely must know about. I will explain what each symptom means, why it happens, what doctors say you should do about it, and how to tell the difference between normal aging and a genuine medical emergency. I will also share with you some simple tests you can do right at home to check your own circulation. And I will give you practical tips from vascular specialists on how to improve blood flow to your legs starting today. Let us begin with the condition I just mentioned, peripheral artery disease, or PAD for short. This is one of the most underdiagnosed conditions in seniors, and it is far more common and far more dangerous than most people realize. PAD occurs when the arteries that carry blood from your heart to your legs become narrowed or blocked by plaque buildup, the same kind of plaque that causes heart attacks and strokes. When these arteries are narrowed, your legs do not get enough blood flow, especially during physical activity when your muscles need more oxygen. That is why the pain comes when you walk and goes away when you rest. Your muscles are literally crying out for more blood, and when you stop moving, the demand decreases and the pain eases. Here is what makes PAD so dangerous. It is not just a leg problem. It is a whole body vascular problem. If you have plaque buildup in the arteries of your legs, there is a very high chance you also have plaque buildup in the arteries of your heart and brain. Studies show that people with PAD have a 4 to 5 times higher risk of heart attack and stroke compared to people without it. And yet, the American Heart Association estimates that up to 75% of people with PAD are never diagnosed. They walk around with this ticking time bomb in their blood vessels, thinking their leg pain is just a normal part of getting older. But the real danger begins when PAD progresses to its more advanced stages. In early PAD, you might only notice pain during walking or exercise. But as the condition worsens, you might start experiencing pain even at rest, especially at night when you are lying in bed. This rest pain is often felt in the toes or the forefoot, and it can be so severe that it wakes you up from sleep. Some people find that hanging their legs over the side of the bed or standing up briefly provides temporary relief, because gravity helps more blood reach the feet. If you are experiencing this kind of pain, it is a sign that your circulation is severely compromised, and you need to see a doctor immediately. Now let me go through the specific leg signs that doctors say you should never ignore after 65. The first sign is the one we already discussed, intermittent claudication. This is the medical term for that cramping leg pain that comes with walking and goes away with rest. If you notice that you can walk less and less distance before the pain starts, or if the pain is getting more severe over time, these are signs that the condition is progressing. Do not wait for it to get worse. See your doctor and ask specifically about PAD. The second sign is a change in the color of your legs or feet. Healthy legs have a relatively uniform color that matches the rest of your skin. But if you notice that one or both of your feet are paler than usual, or if they turn a reddish-purple or bluish color when you hang them down, this is a sign of poor circulation. You can test this yourself. Lie flat on your back and raise both legs up in the air at about a 45-degree angle. Hold them there for about 60 seconds. If one or both feet become noticeably pale or white, that suggests reduced blood flow. Then sit up and let your legs hang over the edge of the bed. If it takes more than a few seconds for the color to return, or if the foot turns a deep red or purple color, that is another indication of compromised circulation. This simple test, sometimes called the Buerger test, is something vascular specialists use in their offices, and you can do a basic version of it at home. The third sign that should concern you is temperature differences between your legs or feet. If one foot is consistently colder than the other, or if both feet are always cold even when the rest of your body is warm, this could be a sign that blood flow to your lower extremities is reduced. Your blood carries heat from your body's core to your extremities, so when circulation is poor, your feet and legs lose heat more quickly. Now, many seniors have cold feet, and it is not always a sign of something serious. But if the coldness is new, if it is getting worse, or if it is accompanied by other symptoms like pain, color changes, or numbness, it is worth getting checked out. And the fourth sign might surprise you. It is the condition of your toenails and the hair on your legs and feet. When circulation is poor over a long period of time, the skin and tissues of your legs and feet do not get the nutrients they need. One of the earliest visible signs of this is a loss of hair on the legs, feet, and toes. If you notice that the hair on your lower legs or feet has thinned dramatically or disappeared entirely, it could be a sign of reduced blood flow. Similarly, toenails that have become thick, brittle, or slow-growing can also indicate poor circulation. These changes happen gradually. So many people do not notice them until someone points them out. But they can be early warning signs that your vascular health needs attention. The fifth warning sign is swelling in your legs, ankles, or feet. Now, leg swelling is extremely common in seniors and can be caused by many different things, from sitting too long to certain medications to kidney problems. But persistent swelling, especially if it is worse in one leg than the other, can also be a sign of a blood clot, known as deep vein thrombosis or DVT. A DVT is a blood clot that forms in one of the deep veins of your leg, usually in the calf or thigh. This is a medical emergency because if the clot breaks free, it can travel to your lungs and cause a pulmonary embolism, which can be fatal. Signs of a DVT include swelling in one leg, pain or tenderness in the calf that feels like a Charlie horse, warmth in the affected area, and skin that appears red or discolored. If you experience these symptoms, especially if they come on suddenly, do not wait. Seek medical attention immediately. The sixth sign that doctors want seniors to know about is non-healing wounds or sores on your legs or feet. When circulation is poor, your body's ability to heal is compromised. A small cut, blister, or sore that would normally heal in a week or two might take much longer to heal, or it might not heal at all. This is particularly dangerous for seniors with diabetes, who already have an increased risk of poor circulation and nerve damage. If you have a wound on your leg or foot that has not healed after 2 to 3 weeks, or if it appears to be getting worse, you need to see your doctor. Non-healing wounds can lead to infections, and in severe cases, they can lead to tissue death and the need for amputation. This is not meant to frighten you, but to emphasize how important it is to take any wound on your legs or feet seriously. The seventh sign is numbness or tingling in your legs or feet. While this can be caused by nerve problems, such as peripheral neuropathy, which is common in seniors and especially in those with diabetes, it can also be related to poor circulation. When your nerves do not get enough blood flow, they cannot function properly, and you may experience sensations of numbness, tingling, burning, or pins and needles. If these sensations are new, getting worse, or affecting your ability to walk safely, it is important to have them evaluated. Your doctor can determine whether the cause is neurological, vascular, or a combination of both and recommend appropriate treatment. Now, there is an eighth sign that many people have never heard of, and it is one that cardiologists and vascular specialists take very seriously. It is called rest pain, and I touched on it briefly earlier. Rest pain is pain in your feet or toes that occurs when you are lying down or at rest, typically at night. It is a sign that your circulation is so compromised that your feet are not getting enough blood, even when you are not physically active. People with rest pain often find that they sleep better in a recliner or with their legs hanging off the bed, because the pull of gravity helps blood reach their feet. If you have reached the point of having rest pain, your peripheral artery disease is in its advanced stages, and you need urgent medical attention. There are treatments available, including medications, angioplasty, stenting, and in some cases surgery, that can restore blood flow and prevent further complications. Let me now talk about what causes these circulation problems in the first place, because understanding the root causes can help you take steps to prevent them from getting worse. The number one cause of peripheral artery disease is atherosclerosis, which is the buildup of fatty deposits, or plaque, inside the walls of your arteries. The same risk factors that cause heart disease also cause PAD. These include smoking, which is the single biggest risk factor for PAD, high blood pressure, high cholesterol, diabetes, obesity, and a sedentary lifestyle. If you have any of these risk factors, you are at increased risk for circulation problems in your legs, and you should be proactive about monitoring your vascular health. Smoking deserves special attention here because its impact on peripheral circulation is devastating. Smoking damages the lining of your blood vessels, promotes plaque buildup, and causes your arteries to constrict, all of which reduce blood flow to your legs and feet. If you are a current smoker, quitting is the single most important thing you can do to improve your circulation and reduce your risk of PAD progression. Even if you have smoked for decades, quitting now can still make a significant difference. Within weeks of quitting, your blood vessels begin to repair themselves, and blood flow starts to improve. Now let me share some practical steps you can take starting today to improve circulation in your legs. The first and most important thing is to walk. I know this might sound contradictory, since we just talked about how walking can cause pain in people with PAD. But supervised exercise, and specifically walking, is actually one of the most effective treatments for peripheral artery disease. When you walk to the point of mild discomfort, rest until the pain goes away, and then walk again, you are training your body to develop new, smaller blood vessels around the blocked areas. This process is called collateral circulation, and over time, it can significantly improve blood flow to your legs. Many hospitals and cardiac rehabilitation centers offer supervised walking programs for people with PAD, and studies have shown that these programs can increase walking distance by as much as 150%. The second thing you can do is keep your legs moving throughout the day, even when you are sitting. Sitting for long periods allows blood to pool in your lower legs and feet, which can worsen circulation problems and increase the risk of blood clots. If you are sitting for extended periods, try to get up and walk around for a few minutes every hour. While sitting, you can also do simple leg exercises like ankle circles, calf raises, and toe pumps to help keep blood flowing. Elevating your legs when you are sitting can also help reduce swelling and improve return blood flow to your heart. The third step is to take care of your feet. This is especially important if you have diabetes or known circulation problems. Check your feet every day for cuts, blisters, sores, redness, or any changes in color or temperature. Wear comfortable, well-fitting shoes that do not rub or create pressure points. Keep your toenails trimmed straight across to prevent ingrown nails, and moisturize your feet to prevent dry, cracked skin, which can become an entry point for infection. If you have difficulty reaching your feet or seeing them clearly, ask a family member to help or consider seeing a podiatrist regularly. The fourth step is to manage your blood pressure and cholesterol. High blood pressure puts extra stress on your artery walls, which can accelerate plaque buildup and worsen PAD. High cholesterol, particularly high LDL cholesterol, provides the raw material for plaque formation. Work with your doctor to make sure both of these are well controlled. This may involve medications, dietary changes, or both. A heart-healthy diet that is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in fish, nuts, and olive oil can help keep your cholesterol and blood pressure in a healthy range. The fifth step is to stay hydrated. Dehydration makes your blood thicker and harder to pump, which can worsen circulation problems. Aim to drink plenty of water throughout the day, and be especially mindful of staying hydrated in hot weather or when you are physically active. Some medications common in seniors, such as diuretics, can also contribute to dehydration, so talk to your doctor about how much fluid you should be drinking each day. I also want to mention something that many seniors do not realize, and that is the connection between leg health and heart health. Your legs are in many ways a window into the health of your entire cardiovascular system. The same processes that cause plaque buildup and poor circulation in your legs are happening throughout your body, including in your heart and brain. So when you take steps to improve your leg circulation, you are also protecting your heart and reducing your risk of stroke. Everything is connected, and the healthy habits that benefit your legs also benefit your entire body. One more thing I want to address is the topic of compression stockings. You may have seen these recommended for improving leg circulation, and they can indeed be helpful for certain conditions, particularly for reducing swelling and preventing blood clots. However, compression stockings are not appropriate for everyone, especially those with severe peripheral artery disease. If your arteries are significantly narrowed, the external pressure from compression stockings could actually make things worse by further restricting blood flow. Always talk to your doctor before using compression stockings, and make sure you get the right level of compression for your specific situation. There are also some warning signs related to your legs that require immediate emergency medical attention. If you experience sudden, severe pain in one leg along with coldness, numbness, and a pale or bluish color, this could be a sign of an acute arterial occlusion, meaning a blood clot has suddenly blocked an artery in your leg. This is a medical emergency that requires immediate treatment, usually within hours, to save the limb. Similarly, if you have sudden swelling in one leg with pain and warmth, as I mentioned earlier, this could be a deep vein thrombosis that requires urgent treatment to prevent a potentially fatal pulmonary embolism. Do not try to wait these symptoms out or hope they will go away on their own. Call emergency services or get to an emergency room immediately. Let me close by summarizing the key points from today's video. Your legs can tell you a lot about your overall health, and certain leg symptoms after 65 should never be ignored. Pain when walking that goes away with rest, color changes in your feet, temperature differences between your legs, changes in hair growth or toenail health, persistent swelling, non-healing wounds, numbness or tingling, and rest pain at night are all signs that your circulation may be compromised. The most common cause is peripheral artery disease, which is closely linked to heart disease and stroke risk. The good news is that there is a lot you can do to improve your circulation and protect your health, from walking regularly to managing your blood pressure and cholesterol to taking care of your feet to quitting smoking if you smoke. I want to encourage you to take this information seriously, but I also want you to know that there is real hope. Medical treatments for circulation problems have advanced tremendously, and many people with PAD go on to live full, active lives with proper treatment and lifestyle changes. The key is catching it early and taking action before it progresses to a dangerous stage. If you have any of the symptoms we discussed today, please make an appointment with your doctor. Ask specifically about PAD and whether you should have your ankle-brachial index tested. This is a simple, painless test that compares the blood pressure in your ankle with the blood pressure in your arm and can help diagnose PAD. Before I go, I want to share one more important piece of advice. Pay attention to how your legs feel at different times of the day and keep a simple log if you notice any changes. Write down when you experience pain, what you were doing when it started, how long it lasted, and what made it better. This kind of information is incredibly valuable for your doctor. It helps them understand the pattern of your symptoms and can lead to a faster, more accurate diagnosis. Many seniors feel like they are bothering their doctor with these concerns, but I assure you, your doctor wants to know about these symptoms. It is far better to mention something that turns out to be nothing than to stay silent about something that could be a serious warning sign. You know your body better than anyone, and if something does not feel right, trust that instinct and get it checked out. Your legs have carried you through an entire lifetime of experiences, and they deserve the same attention and care that you give to the rest of your body. If this video has been helpful to you, please consider subscribing to this channel. I am dedicated to bringing you clear, practical health information that can make a real difference in your life. Hit that subscribe button and turn on notifications so you never miss a new video. And please share this with your friends and family, because the more people who know about these warning signs, the more lives we can save together. Thank you for watching, take good care of those legs, and I will see you in the next video.